Hi, welcome. Why don't you both have a seat?
Yeah.
Sure.
Hi. Thank you. I'm sorry. But I don't quite understand why we're here. I mean, our son who has DMD. Shouldn't he be here too?
Honey, we need to get all the information about the DMD children, and we just got the diagnosis from the doctor right now. And what do we expect?
It's totally alright. I understand that you both are probably in shock right now, given the news that you just heard. It probably wasn't easy. That being said, I want you both to know that I am here as a resource for the both of you.
Thank you so much, but how can you help us in this situation?
Well, I'm a psychologist, and the reason that your DMD specialist recommended you to me is there are some things that as parents of a child with DMD, you should know. As parents of a child with DMD, it is important that you understand and be able to accommodate your child's very unique and particular developmental, emotional, and psychological needs.
Wait. Developmental and psychological? Wait, I thought DMD was just like a primary muscle disease. Well, now you're saying there's like a psychological and developmental component to this?
Well, you're right. DMD is a primary muscle disease, but the protein that's missing from the muscles, dystrophin, is actually missing from parts of the brain as well.
So, one missing protein from muscle is going to have effect on brain function as well?
Right. Well, admittedly, research on this subject is a little unclear. But what is known is that there may be some unfortunate psychological and developmental consequences because of this fact.
Wait, consequences. So, you're saying this because of DMD, my son will be less intelligent than normal?
On the contrary, your child, he will compensate quite well as he gets older, and even potentially be able to live reasonably independent life. That being said, it's important that you be patient and understanding as your child's developmental process may be slightly different from other boys.
What do you exactly mean by different?
It's a good question. Well, just as an example, patients with DMD tend to show delayed onset of speaking. They may also become easily frustrated when trying to learn new or challenging concepts.
So, honey, don't you remember how we mentioned to our doctor that our son he didn't speak until he was almost 3, right? Is that yeah? Is that an example of like this type of deficiency that you're talking about?
Yeah, that is an example. But you'd be happy to know it's not permanent. Your child will catch up with his peers after a few weeks.
Ah, okay.
So you're saying this progression is different but not permanent, is that right?
That's exactly right. That is what the research shows. However, the research also suggests that your child might be more prone to learning disabilities. This includes dyslexia, which I'm sure you both have heard of. It may also include, to a lesser extent, dyscalculia, which is a disorder related to trying to work through and comprehend math problems. There are also increased cases of behavioral disorders such as ADHD and OCD in DMD boys.
So what can we do to remedy this? I mean, is there like a cure that we can give our son?
Well, unfortunately, no. There is no cure per se, but these sorts of things can be managed with family and with the support of a specialist, especially if caught early on.
So, you earlier mentioned that there's some emotional problems as well. Do you mind explaining us what sort of emotional problems are they?
Well, it's a very valid question. Well, you see, DMD, it's a chronic illness. And what that means is that there will come a point when your child has to come to terms with the fact that he's a little different from his peers in terms of what he's able to do physically, right? In DMD boys, this tends to occur around ages 8 to 10, when your child might notice that he's not quite able to participate at the same level in things like sports and other physical activities.
So do you think that's like also going to occur later on, or is that the only one? Like, do you think he'll occur when it's a wheelchair bound?
I mean, for obvious reasons, yes, your child will probably sense even more greatly that he's a little different when he becomes wheelchair bound later.
So, okay. So what's he gonna do when he's confronted with that? Will he act out? Will he become depressed? And is that sort of behavior normal given the circumstances or whatnot?
Well, it depends. Each child is different, but it is a valid concern, and it's probably best that you be prepared for the chances of that happening.
So, what do we do? I mean, how can I handle this situation?
Well, first keep in mind that your child might be more prone to anger and to lashing out. It's understandable given the fact that your child has to face some pretty lofty obstacles, some very unique challenges, and these kind of things are difficult for boys of any condition. So I would just recommend that you're sensitive to his emotions, sensitive to his emotional development, allow him to process through his emotions. Encourage him to learn from his mistakes, for example. And if he comes to you struggling, be prepared to listen to him. Be prepared to help him work through his emotions. Also, I would suggest it's very, very important that he develop strong emotional connections with his peers, as this is very important for his overall emotional development.
But he would be different from his peers by then, and I don't know how his friends, they're gonna react to him, how teachers react to him. And I really don't wanna go to teachers and tell them and they think that he's totally different from others and he's sick or something is wrong with him. I don't want that feeling I don't want that they think that he's flawed and sick.
Of course not. It would be unhealthy for your child to see himself in terms of an illness, right? I mean, he could become depressed, he could have self-esteem issues. So it's an absolutely valid concern, and I'm glad you asked. I would say that it's important that you, to kind of counteract this, emphasize his strengths, right? Emphasize the aspects of his personality that are separate from his illness. Maybe, for example, if he has a sense of humor, try to cultivate that in him. As for his teacher, make sure that he or she is aware of his illness, but also aware of his strengths so that she can support and encourage them in a classroom setting. As for friends, when you introduce him to new people, do it in a way that emphasizes some of these positive personality traits that I was talking about, and not in a way that emphasizes his illness.
I mean, thanks for the advice, but it just seems so overwhelming. I mean, I know you mentioned that children with DMD can compensate for all these learning obstacles, and if given support from us and their friends and teachers, they can have stable emotional bonds. But
yeah,
these all, like you mentioned, there's all these lofty obstacles, and even for me, it seems overwhelming. So how do I explain this to my child? What do I tell him?
Your concerns are valid, and I understand your frustration. I can sense that. It's very, very valid given your current condition. I do think it's important to treat your child as normally as possible, right? Even though he has some pretty obvious differences from his peers, I think it's important that you don't shelter him emotionally, right? Let him develop the proper emotional tools to navigate his emotions and navigate his life, right? If he has questions for you, which will probably arise, for example, if he asks you why he's different from his peers or why he goes to the doctor a lot, don't be afraid to answer his questions honestly and truthfully. That being said, don't use words like sick or broken or flawed or anything like that. Of course, use words like unique and special so that your child understands that, you know, apart from a few things, he's just like his peers.
So, that might be okay for right now, but I don't know, what about his future? I don't know if, as a mom, I really want him to have a life as other normal boys, to have really normal life and normal future. I don't know, how can I prepare him for this lifestyle?
I mean, my wife's right. I mean, DMD children, they don't live as long as normal peers. They don't have the same life experiences, and like, they have to deal with all this throughout their lives. And how do we prepare our child to deal with all this, and yet still have like something resembling like a normal life, you know?
Well, it's a difficult subject, I understand. But there are, I think you should know, there are some treatments and therapeutics being looked at right now that could potentially improve the quality of life of your child. Therapies like exon skipping, steroids, these are things that have actually been shown to potentially increase the amount of time your child has to walk, which is something that's obviously very precious.
But not these treatments don't work all the time for everybody though, right? And some of the more promising ones are still stuck in clinical trials. What happens if we don't have access to them or if they don't work?
That's a valid concern. Even if your child is unable to take advantage of some of these therapies, and even if he does become wheelchair bound, there are several assist devices that could allow your child to drive, to even start a family. All that being said, I think it's important that you both keep in mind that your child he's wonderful and he's unique, and the time that you have with him, it's precious, and it will leave an impression on you.
Thanks for all your advice. Me and my husband, we have never been in this situation before in our life, and this is a very new situation for us. I don't know how can we handle that, and I'm not sure about myself at all.
It's very valid to be feeling the way that you are feeling right now, given the sort of admittedly immense, very challenging obstacles that you two are going to have to face. I'm not going to lie to you and tell you that it's easy, but I will say that you're not alone. There are people just like you two who have gone through exactly what you are going through right now, and if you think it would be a valuable resource to you, I would be happy to give you some of their contact information.
Oh,
Thank you.
yes.
Yeah, that's very helpful.
Yes, that will be very much so. Thank you so much.
Of course, anytime. And just remember, if you have any more questions for me, I will be here.
All right, thank
you
you
so much.
Thank you so much.